Oh, I would say 10%. In our area,
Okay.
it's higher than that because we're in a very wealthy area, the Upper East Side of Manhattan. But I'd say across the country, it's no more than 10%.
Yeah. Okay, got it. 10% that's consistent with what we've heard as well. For Amyvid, Neracheck, and Bizamyl, do you have an inkling or an idea of what sort of market share these three PET tracers have? Given Amyvid was the first mover, we hear it's has a bigger share, but could you maybe lay out an estimate of what share Amyvid has versus Neracheck or Bizamyl for PET tracers?
I would guess that it's probably got 50% or so.
For Amyvid?
Yeah.
Or
Which is the original, that's the one that Lilly took over, isn't it?
right.
I would guess 50% because they market it well and they can get the tracer out.
If there is no change in the treatment landscape for Alzheimer's over the next 5 years, what percentage of patients would actually receive a PET tracer in the future? Would you see like an increase, like a percent increase over the next 5 years for PET tracer usage outside of the research setting, in the clinical setting, or do you think it'll be flat? There'll be less usage in the clinical practice setting?
I think it'll be flat in the clinical practice setting. In the research setting, I expect it to go up.
Okay, so flat in the clinical setting. For the research setting, how much would you expect it to increase if you had to estimate over the next 5 years? We're also doing some calculations on our end, but
I think it's going to increase 50%.
In the research setting? Okay.
Yes, because a lot, well, at least we are and others are using it as an entrance criteria for clinical trials.
Yeah.
So
Okay.
using it as
Yeah,
an
I think
entrance criteria is the screen, so every single patient that you put into your trial has to have one.
yeah. In the event so a couple other scenarios. In the event a drug class were to be approved, like a anti-beta amyloid, what percent would actually be approved? Oh, sorry. How would PET tracer usage actually change? Let's say one of these molecules in phase 3 development is actually approved in a few years. Could you maybe discuss what's the change in that sort of number of patients who would actually get a PET scan? How would that increase from what you see today in the private setting?
I think it would increase.
So I think
it depends on. Let me put a caveat in. It'll increase in concordance with the increase in usage of your anti-amyloid therapy. Because at least for me, I would want to verify that the patient really has amyloid before I treat him with an anti-amyloid agent.
Absolutely.
It turns out that if you, at least in our hands, this is true over at Columbia also, that 30% of the people who have been diagnosed as having AD are amyloid negative.
That's very interesting. So, Dr. Gill, can I run you through two scenarios real quick, just kind of to understand what will happen if they're in the future landscape of PET usage? As we were talking about, if there's a drug approved in the private practice setting, how would you imagine, you gave us a number around 10% of patients in the private practice get a PET scan. If there's a drug approved in a few years, how many of those patients would then receive a PET scan in the first year of approval?
Of the